Welcome to the Better Birth podcast. I'm so excited today to have the very lovely Vanessa, the autistic chef, on to talk about her pregnancy and birth journey. Welcome, Vanessa.
Hi, thanks for having me, Erin.
Oh, I'm so excited to talk to you. We connected over Instagram, didn't we, when you were pregnant?
Yes, I was very early stages pregnant, as in like probably less than a week. And I'd already started my autistic research into pregnancy and birth, and I'd found one of your, I think TikTok videos, and then found you on Instagram. And I was like, I like this because it's backed up with facts, actual stat, and the sources are all cited. I'm going to follow this account. And then, you followed me back, we messaged, and then 11 months later, here we are.
Yay. Oh, it's been really lovely though, like chatting with you throughout your pregnancy, and I can relate a lot to the things that you would say, or the content that you posted, and when you'd ask me questions or you'd say something, I'd be like, yeah, I can empathize and I can understand where you're coming from. And it's been, I think, an interesting journey for you navigating that pregnancy from the very early stages to giving birth. And that's why I'm so excited to talk to you today, because I think it's really important, um, as somebody that's pregnant, navigating the NHS, maybe not wanting to follow some of those guidelines and having to advocate for yourself quite strongly, and coming up against resistance with that, which I think a lot of us do, and we ask questions and can
Yep.
be told we're being difficult maybe, or we're kind of not just nodding and agreeing blindly. So I really wanted to get you on to share some of that journey, and the challenges that you came up against and how you did manage to advocate for yourself, because I think that's something that a lot of us really really struggle with, advocating
Yep.
for ourselves in medical situations, pregnancy and otherwise. So do you want to talk a little bit about, your pregnancy and what happened throughout your pregnancy and some of those appointments that you had?
Sure. So I think it all starts with you going to the GP at first, right? And you wee on a stick, and somebody tells you, yeah, you're pregnant. And then weirdly, I thought that the GP would kind of do everything for you. But actually, you're sent on your merry way, and you're told to pick a hospital. You're told to register yourself online. Everything is in your hands. And that just feels like a lot of pressure for somebody that has just been told they're potentially pregnant, but doesn't know if it's a viable pregnancy yet. And so I spent a lot of time speaking to friends and people in the area to try and find the best hospital. I think I even spoke to you on which ones I should pick. And that is where my journey started. And I probably wasn't as confident at the beginning as I am now, 10 or 11 months later. But I picked a hospital that had quite a good reputation in London. It was one, I bypassed my local hospital because it doesn't have a great reputation. And apparently, I don't know whether it's true or false, but a few in and around me that are not super close, but not super far, I was told actually are not accepting people outside their postcode. So I'm not sure. But what I did realize very, very quickly was do not be afraid to leave that hospital if you do not feel it is right for you. And
Mm.
so the first hospital I picked, I had 2 appointments there, and I knew this hospital would not be right for the care that I needed. I was told at 8 weeks pregnant that I'm already high risk because I have autism. What is this condition that you mention? Autism and AHDD. The midwife said, what is AHDD? I was like, do you mean ADHD? And I was just like, this is not great. And she wrote autism, AHDD, and SPD, because I said SPD, but I don't think she knew it meant sensory processing disorder. She wrote it on a tissue paper, not even a piece of paper, a tissue paper. I was told because I have these conditions and because I'm over 35, I'm already high risk. So that already made me want to leave. And effectively, I didn't even know if my baby had a heartbeat at that point. No one even scanned me. So, second hospital I went to, unfortunately, was so under-resourced that it didn't have a birthing centre that was open. Now, I appreciate that was very early stages of my pregnancy and things can change, but it wasn't a risk that I was willing to take. So I ended up picking a hospital that is miles away from me, but it was one that aligned with my values, that was willing to look at my pregnancy journey and make a decision according to those stats, which I'm completely on board with and makes logical sense. And I can honestly say, up until the very end, I had a brilliant experience, apart from a few occasions where I think all women are pressured when they get past a certain point. But all of the midwives at the birthing centre were incredible, and I have my utmost respect for them. And if I have any more children, I'd most definitely go there. But 3 hospitals within the first trimester. Imagine 3 hospitals within 12 weeks. And if I hadn't have ended up with my 3rd hospital and being happy there, I would have happily gone through 5 or 6, because it's so important that you make the right decision. And I think a lot of women realise that that care or that hospital isn't quite right for them, but they don't feel like they have any other option. Once you're in the system, they think that that's it. So that would probably be my first tip. But yeah, my journey at the hospital that I ended up at was just brilliant, because the hospital is obviously where you give birth, but I actually had all of my appointments at a health centre, which makes a huge difference because 1, it's really small. 2, it's mostly the same staff that work there. So I would say 80% of my appointments were seen by the same midwife, which I think is great. And yeah, it was just more sensory friendly, to be honest. You feel like you're going to a GP surgery over a hospital, which, I mean, neither's great, but if I could pick between the two, I'd pick the surgery for sure.
Yeah. So you mentioned kind of sensory processing disorder, and you're very vocal about being autistic and what that means, and I think raising awareness of autism and ADHD, and I find it equally terrifying and frustrating that a midwife that you went to see at an antenatal appointment didn't even know what autism or ADHD is, because I would say that's probably not a unique situation or occurrence. And then how can a midwife adequately support somebody who is neurodiverse, either with autism or ADHD or both, when they don't even understand what that is? That, like, it blows my mind. Like, that's a huge issue, right? Massive issue. Supporting someone antenatally, but also during labour.
Yeah. And actually, so that happened in the first appointment at that first hospital, but I decided to not disenroll. I don't know if that's a word. I decided to not leave that hospital knowing that I'm going to have a scan within 2 or 3 weeks. So obviously I'm going to wait for the scan. So the scan was another opportunity for them to, I guess, instill some confidence. So I went into that scan appointment and I said, by the way, I'm autistic. I don't need many adaptions because the room's dark, but I just asked for 2 things. 1, that I put the gel on my belly myself because I have a lot of sensory issues. It's quite cold and I need some notice. And 2, you talk me through things because I need to know what's happening. And she was like, don't worry, it's fine. However, she went onto autopilot mode. And all of a sudden, the gel went on my belly. And that just sent me into an absolute tears. And it ruined my whole scan experience. There wasn't any communication. And both my husband and I were not told that actually she was not a sonographer. She was somebody who could do the scan, but actually a sonographer would have to come in. So what ended up happening is I was in a tears because the gel was on my belly and I was having lots of sensory issues. And then we also thought that there was something severely wrong, or the baby didn't have a heartbeat, because then a second person came in and there was just no communication. So that was the point I left that first hospital, and I just thought it was conducted so badly. But in my general encounters with medical professionals being pregnant, irrespective of hospitals, I'm finding that people stereotype a lot. So it's like, you're autistic. Is that like actually diagnosed? Because I don't fit what they think autism looks like. And then the ones that are a bit more open-minded, sometimes they think, well, you're autistic, so that means you don't like bright lights and you don't like kind of noises. And yes, I don't like bright lights, but that's not my be-all and end-all of issues, because I haven't got to 38 years old without bringing sunglasses to an appointment, you know, like the advice of, oh, don't worry, you can wear your sunglasses in the room is not helpful. Actually, the advice is not putting the blood pressure machine on my arm without telling me. It's almost like consent is just implied, but you can't do this to an autistic person, where it makes me feel like I want to amputate my arm when somebody puts that machine on me. And I say this because I'm jumping ahead now, but I had a completely unmedicated birth. So I'm like, not a wuss when it comes to pain, but there's certain types of sensory pain that are way worse for me than others. It's all these small things that, you know, people will touch your belly and feel fundal height and all these things without actually giving you the note, or giving me the notice that I need. And I think there just needs to be a lot more education around that, because now, obviously, once that I've experienced that, I can now say, please, can you stop? Or can you tell me before you do something? But if you don't know what you don't know. So I had to experience the kind of bad sensory side, then the meltdown to learn, and then go into my next appointment saying, by the way, these are the accommodations I need. But you don't know your accommodations till you need them.
It's I think the concerning thing is that the fact that people are asking you, oh, are you diagnosed, or are you actually autistic? And this is something which, you know, I have a personal issue with, right? It boils my blood, because a lot of female autistic individuals spend their entire life masking their autism. They don't fit this very stereotypical representation of autism that we see on TV and we see on films, which is quite often, you know, that kind of very overtly autistic representation. And we're talking about people who are autistic and pregnant, going through those pregnancy appointments, probably not presenting as a stereotypical autistic person, and they're not having any accommodations made for them. And these accommodations, by the way, should not just be made for autistic people. They should, I mean, everyone should be asked consent before their bodies are touched, right? It shouldn't just be an autistic person that, you know, oh, she's autistic, I must ask before I put the blood pressure cuff on, or I must ask before I, you know, lift her top up to put the gel on her belly. It makes me really cross, as you could probably say. It makes me really, really cross that people are so misinformed, I think, about autism.
They really are. And then sort of as you get late, because a lot of the appointments are the same at the beginning, aren't they? You know, scans, checks, you know, feelings, whatever. But it's really towards the end where you see, I guess, the bigger picture. And I actually gave birth at 42 weeks and 5 days, which, wow, let me tell you, was a full-time job fighting the system. And kudos to the hospital I was at, because I privately messaged the birthing centre on Instagram to say, regardless of my gestation, will you support me? And they replied back saying, yes, even if you went to 44 weeks, we will support you. And that gave me the confidence to push back against all the consultants and all of the doctors that was, one, so factually incorrect and misinformed, and two, are not basing their advice upon my medical needs and my needs as an autistic person. And all I can say is navigating those appointments as anyone, whether you're just a female, whether you're neurodivergent like me, was hard. And I think the more vocal I was, because I was very vocal towards the end, because I was just so frustrated. No one was listening to me, and because I was saying no, I think it was just causing more issues. So I have to explain why I'm saying no to your recommendations, because they make no sense to me. I was seen as, I guess, difficult. I was seen as misinformed, when actually, factually, I'm more informed than you, because one doctor actually she was a doctor as well. She had to go away, and I said, please don't come at me because I have these stats in my brain. Please do not have this conversation with me unless you can have factual evidence and stats to back up what you're saying. She had to go away, and she came back 45 minutes later with printouts. Not even from that hospital, by the way. It was like a different hospital's guidelines. And I just think that's shocking. You're trying to derail my birth, my choices, and actually what I really need, because as an autistic person, it is not conducive to give birth on a labour ward. No. Like, there will be zero oxytocin flowing there. So do not remove my choices that allow me to use the birthing centre, because no baby will be coming out. Yeah. And I'm out of borough for a home birth, unfortunately. So I had no option but to keep myself in a situation where I could be supported in the birthing centre.
Yeah, I think. Yeah. I think again, it's a really common situation. I think that autistic or not, neurodivergent or not, as a pregnant person, if you've done your research, and you're declining a recommendation, or you're wanting to birth outside of guidelines because you're happy to go past 42 weeks, or they say that you're high risk because you're, an older mother, or you have some other risk factor, that they can't back it up with the evidence for their guidelines and their recommendations quite often. And I think it's because they almost regurgitate this stuff, and I don't know if they've forgotten what the evidence was, or the policies and guidelines don't have that evidence behind them. But I know, we were talking about this before we started recording, I know as somebody who I strongly believe that I'm neurodivergent, and I will argue until I am blue in the face if I know that I am right. If I've done my research and I know what the evidence is, don't come at me and tell me that you are right when I know factually that you are incorrect. And I will fight to the death to prove that I am right, and it's not being argumentative. It's just this really strong sense of I have to make you understand why you are wrong. Correct. And that's really hard when you've got a medical professional going, no, but you have to do this. But why? Why do I have to?
Well, ironically, I mean, at one of my later appointments, I think I was probably 41 and 5 days. So it was at the point where the hospital are like, generally, this is our cutoff point, and we would recommend an induction. And I was seeing a consultant with 15 years or 20 years experience. He was an old white man, by the way. And I knew at this point, I don't know when he last actually saw a birth. I don't know. But he definitely didn't know his stats very well. So I was asking him, because he was throwing the stillbirth word out a lot. And that's fine. It's an uncomfortable topic, but I know what those stats are. I know them. And I have them embedded in my brain. And I have made an informed choice based on those stats that actually my odds are way better and my baby's odds are way better, still bypassing the induction route. Also bearing in mind that I have lots of allergies. One of my allergies includes a latex allergy. Now, I am an autistic individual that has read all of the inserts for the things that they're suggesting. Now, the Syntocinon basically has a package insert which says, do not give this if the person has renal or kidney problems, or if they have a latex allergy. So my question to the consultant was, you're recommending an induction for me, but what would you do when technically I haven't a latex allergy? And he was like, well, we just use different gloves, thinking that was the issue. And I said, well, actually, if you read the package insert, this is what I'm referring to. And he said, in my 25 years, it was about 20 or 25 years worth of experience, I have never come across this in my life. And I was like, I appreciate that. You have a lot of experience, but I got this off the internet. So do you want to download it or just go upstairs and get the package insert? You can have a look for yourself. And it was quite embarrassing because he also had a trainee doctor kind of learning off him, and he refused to do it. And I was just like, okay, well, will you promise me? Yeah, he was just like, I've never seen that. But either way, I was still declining the induction anyway. And then I had another doctor that basically said, well, we prefer the baby out because then we can see what's going on. And I said, well, logically, that makes no sense because effectively, you might risk me going into anaphylaxis, giving me that induction drip. And then she said, yeah, but it's okay because we have a solution for that. And I was like, you're causing the problem that you're now trying to fix. Honestly.
God, I feel like...
Honestly, and then my husband was trying to like kick me because he's just like, there's no point in having these conversations. You're just arguing for no reason. And the outcome, because he's ADHD, but also he's completely the opposite to me. Like, his sense of justice is not quite the same as mine. He just wants to be low key and out. You stick to your principles, but you just don't kick up a fuss. So he's kicking me, basically saying there's no value in this, Vanessa. Like, you're still declining it. So just nod and smile. And you're just causing more problems for yourself. But then I couldn't help it because in that same conversation, the same consultant, it was questioning why I'm basically declining this induction. And I said, I would prefer natural oxytocin over synthetic oxytocin, which my brain will not register. And he was like, but it's the same. And I was like, no, it's not. It doesn't cross the blood-brain barrier. And he said, yes, it does. And I was like, please Google this. Please Google this. But unfortunately, I didn't have the balls at that point or the energy because, well, I was 42 weeks at this point and just driving 2 hours to an appointment and knowing that you're going to have a fight is just stressful enough. And of course, my baby's not going to come out. I'm in fight or flight almost every day because let me be clear, when I'm declining these things that don't work for me, like an induction, I'm not doing things blindly and I'm not doing them based just on stats. I'm doing them based on my stats. So I am choosing to go in for monitoring every day because every day there is no change in my baby's heart rate. There's no change in my stats. I don't have preeclampsia. I don't have any of these things. I don't even have gestational diabetes, despite my apparent high risk, given my ethnicity, and age, and, wait for it, BMI. Because I am apparently in the clinically obese category almost, because my BMI is 29.3. And pre-pregnancy, I was a size 8. But obviously BMI doesn't take into account a 5-foot female that has a lot of junk in their trunk. So yeah, I mean, what can you say? So, yeah, it was all fun and games, really.
I'm actually speechless.
I mean, ironically, I actually recorded that conversation, not to publish anywhere, but because that's another thing I like to do, because sometimes there's so much information in one appointment, especially when you get to the end appointments. I like to voice note or voice record them so that when I get home and I forget or I have a blank, I have a record. Yeah. And sometimes I listen to that 40-minute recording of the consultant just for a laugh, because his stillbirth stats, where he was throwing around stillbirth, I said, do you actually know what those rates are that you're referring to? And he said 2 or 3 in 300. I was like, are you sure about that? Because those are not the numbers in any of the things that I'm looking at. But then I didn't want to get into a fight and bring out my printout, so I just swiftly moved past. But sometimes I listen to that voice note for fun. But it's actually shocking that people often think consultant-led care is better, when actually, in my opinion, it's completely the opposite. I had the best experience with the midwives who actually know that they deal with this day in, day out. And they know exactly what they're doing. And when doctors are telling you, you know, shoulder dystocia is a huge problem, especially because you're so small, you know, you're all baby. And, you know, there's not, and I was like, scan me. If you think my baby's going to be big, why have you not scanned me since 20 weeks? Why are you not checking for my amniotic fluid levels? Why are you not checking, even though it's inaccurate, like size, you know? Before you say, I feel all baby. And the shoulder dystocia, like, what would be your recommendation if it did happen? Because it can happen at any gestation, right? And effectively, it gives me the most comfort that in the birthing centre, they'd recommend different positions, which is what I would do. You know, I wouldn't jump straight to the worst case scenario, which is just a lot of interventions.
Yeah.
Unless they were needed, obviously.
Yeah, I think obstetricians, they have a time, they have a place, and their expertise is complications in pregnancy and birth, right? That's what their expertise is. But the problem is, so many of us are being told that we have high risk and complications because it is virtually impossible not to be, you know, meeting one of those tick boxes these days.
Yeah.
You know?
Yeah.
But no one's actually quantifying for these poor people that are pregnant, what is the risk? What you know, quantifying the risk of the thing we're trying to prevent, and actually, are you actually high risk? That label high risk, when you actually look at the risk, is not high. It's actually very, very unlikely. And then we're being shunted all into consultant-led care, and then being told that we need to do X, Y, Z, when actually we probably have better outcomes if we just got left the hell alone under midwifery-led care and give birth at home or in a midwifery-led unit.
Yeah, I also appreciate that it is difficult for hospitals as well, because, you know, when we got to the 42-week kind of discussions, I was getting calls almost every day. And at some points, they were basically saying, look, can we just book you the induction appointment, which you could maybe not show up to? And I was like, that makes no sense to me, because it's putting the pressure on me to not show up. But also, I don't want to waste resources.
Yeah.
Second of all, I think above all, it's just added pressure you just don't need. You do not need it. But at that point, the person I was speaking to actually said, it's more for us to manage our patients. And I basically said, I'm really sorry, but that sounds like a you problem, you know? And I think then it just got really awkward and there was just silence. So then I just put the phone down. It was, autistic awkward moment. But like, I don't know what to say at these things, because it's just unnecessary. It really is. And then I also, towards the end, at the beginning, there was a lot of sort of medical professionals that assumed because I'm autistic, my default birth choice would be a cesarean, because you like routine, you want to know when your baby's coming out, etc., etc. And I think what's really important to note is a C-section might really work super well for some autistic people for those reasons. It doesn't work well for me. And it's interesting because I actually took the time to explain why. And I think it helped them really understand that not all of us fit this same kind of box. Yeah. And I said, yes, I like routine. Yes, I like to know when this baby's coming. But ultimately, I know this baby's going to come out at some point. So we know it's going to be at some point. I haven't lost my mucus plug, but I feel it coming. I'm having contractions every night that I feel are going somewhere. So my body is preparing for that. But for a C-section, it would really disturb me that I couldn't feel anything, that I would have pressure of the tugging, but suddenly my brain would have to comprehend that I'm numb and I'm just handed a baby. My brain needs to process from start to finish, even if it's painful. So this is why, and I said it without knowing how bad the pain would be, and knowing full well that I had the choice to then go back on it all and take an epidural. Like, I kept my mind very open, but I knew the best thing for my autistic brain would be to have a spontaneous labor, an unmedicated birth, because I need to feel everything, and just to be left alone in a sensory friendly environment. So a birthing center would really fit that. And, you know, the hospital I picked, it was incredible. Like, they had fairy lights, everything. And the fact that all the midwives were trained to just be completely hands off. You don't need to be in fight or flight to advocate for yourself in the same way that I would have had to, I think, in a labor ward. And once I explained it, they were like, wow. You know, I said, the fact that you think I'm safer in a labor ward, literally across the corridor, these lights are killing me. You know, I had a labor that lasted, I want to say 16 hours. My maths is bad. It is 16 hours. And I spent 12 of those 16 hours in the toilet. With the lights off, on the toilet, because that's the safest place for me, where I feel most comfortable. And it's obviously where everyone's pelvic floor is most comfortable. And the last 4 hours I spent in the birthing pool. And I can honestly say I had a it was painful. It was very painful, but it was manageable. I don't know, like, all respect to women that are like, oh, it wasn't painful at all. It was. Like, if there was a way where my brain would have kind of taken drugs but then been able to process it, I don't know. I preferred my experience to feel everything. I felt every push. And what I found really, really interesting is that I think midwives are so used to coaching. They are so used to coaching the pushing that there is such a delay between actual contractions and coached what they see. And I found that fascinating, because you're being coached when there's no contraction, because there's obviously a delay. And what I thought was very, very special was that some of the midwives and staff that we had on the day, they thanked me. And I was like, why are you thanking me? I should be thanking you. And they said that they barely get to see fully physiological births from start to finish. And mine was extra special because, one, I was very vocal back as to why, for example, their coaching is not helping me, because the contraction went 30 seconds ago, but they're still seeing a delay. Second of all, I proved a lot of people wrong. The fact that you can push past all of this and still have a spontaneous labour that is low risk, despite being almost 43 weeks. And also, I had a placenta issue. I don't know if I told you about this, Erin, but basically, my baby Rio, usually the head comes out and then the second contraction happens and then the shoulder and the body comes out. My little man was clearly quite desperate. He'd been in there too long now. So his head and shoulders came out together. Then there was massive meconium, and I think he just got a little bit distressed. So when he fully came out, his APGAR score was low. It was 4. So typically I wanted to keep the cord attached for as long as possible, but we had to cut it. We cut it within 60 seconds, and what I wasn't aware of is that when somebody pushes that red button, whether it's a dire emergency or a not dire emergency like ours was, I was not aware of what happens. And all of a sudden, 30 people were in the room, which I'm grateful for in a big emergency. But as an autistic person, I didn't know that was going to happen. So imagine you've just given birth, you're in shock, you've got that elation, but you're also like, what's happened? Is my baby alive? Why is there 30 people in here? The alarms are ringing. I'm now in a pool that's filled with meconium and now some blood. I'm distressed. my husband's now gone to be with the baby. I don't know what's happened. I can't see him. I can't hear him. And that just killed any oxytocin. So whether you have the golden hour or not, because a minute later he was absolutely fine. He weed on all the staff. He was fine. He just needed a little bit of time. He's like me, delayed processing. And I had the full golden hour. I had the skin to skin. I had him on the breast. But my body was just like in shock. So my placenta, I chose to have it unmanaged. Obviously was not going to come out. 4 hours passed and it still wasn't coming out. And effectively I had all the midwives rooting for me, but saying, I'm really sorry, I can't hold off the doctors any longer. They are basically saying, even now, the injection is not going to work because your cervix is closed. So we're probably now, after having a fully unmedicated birth, going to have to give you an epidural and take you to surgery. And I was like, no. At which point I had to have so many chats with staff of risk of sepsis, risk of everything. And I was like, please just give me a bit more time. And I was just so lucky that it was a changeover of staff. That 7:45 to 8 p.m. staff. So it bought me a bit more time where they had to tell the new staff what the issue is, but then they also have to have a conversation with me. I then called my doula, which I don't know why I didn't do in the first place, but I guess you're all in shock. And I said, after all of this, they want to take me to surgery now. And she was like, Vanessa, you're autistic. Go into the toilet, naked, skin to skin, with your husband, with your baby. Take your clary sage, take your music, put your baby on the breast and just sniff the hell out of his head. And guess what? It came out like a bad curry the next day, quicker than anything I've ever seen before, and this was 6.5 hours later. And that placenta got paraded around. Honestly, all the midwives were like, look at it. It came out without fully physiological. Despite everyone saying your cervix is closed, not even the injection will help you at this point. Yeah. And it's just like, more lessons need to be learned from that. Just let the body do what it needs to do, unless there's an issue. Obviously, unless there's an issue.
Yeah. I think what makes me a bit sad is the amount of research. Obviously, I mean, you're more, you're more likely to do all that research, and I would, because of our autistic brains. But the amount of research that somebody does have to do in order to advocate for themselves, in order to make the right choices, because you couldn't just blindly go ahead or go along with what you were being told. Even after giving birth to your baby, you still had to question things to get the kind of physiological birth that you wanted. I think it does highlight the need for people to not wing their births. Yes. Neurotypical or neurodiverse, it doesn't matter. Yeah. It is so important to do your own research and educate yourself, because you cannot go into birth and just wing it, because you might come out the other side unscathed and happy, but you have I would say a fairly good chance of coming out the other side and not being very happy with your birth and how it went.
Yeah, honestly, the women that say to me, I'm just going to go with the flow, I was like, in my head, I'm thinking only dead fish go with the flow. Please don't do this. Educate yourself. Educate yourself, because, statistically, and I feel sad because so many people in my NCT group, I'm not here to dissuade people. I'm just here to give them the information that I don't feel is given to women at appointments, even the small things, like people, when they offer you a membrane sweep, or water's breaking, you use what I think, that's incorrect terminology. They've called it a membrane sweep because if somebody factually said what they were doing, I am going to stick my fingers up there and detach the sac from, the thing that is keeping your baby safe and well and not infected, you know, women would be like, no. But it's just a membrane sweep, you know. Are you happy with that? It's so casual, it's so blasé. And the whole, I'm going to break your waters, it's like, what? I'm going to stick a knitting needle up there and basically burst what has kept you all safe for a long time. And then also fail to mention the hospital rules that maybe in 12 hours, if nothing's happened, then we actually, because of risk of infection, have to take it to a stage which you're not willing to go to. And it's the lack of foresight that's happening at each point. It's women are not informed from the very beginning. And I was probably one of the most vocal in my NCT classes that I think all the couples thought I was the crazy woman that just says no to everything. But actually, I predicted all of their births and I was spot on with all of them. I was like, please don't go in for this membrane sweep. So one of them went in for 3 membrane sweeps. Like, dude, if your kid is not coming out after 3 membrane sweeps, like, it's not ready. There is no amount of inductions that can force a baby out. So statistically, you're going to be the high percentage that end up in an instrumental birth or a C-section. And that's exactly what happened to all of them. And ironically, they all ended up with an induction that took 4 or 5 days. When, like, what if you just waited those 4 days?
Yeah.
Maybe your baby would have been ready. And maybe we're all now effectively between 4 and 6 weeks postpartum. I was out probably 3 days, like out and about walking. I didn't have any stitches. I had a 2nd degree tear, which didn't need a stitch. And I chose not to have a stitch because stitching sounds horrendous. All of my NCT groups all had inductions. And they all ended up with episiotomies and instrumental births, which was so predictable. And they're all still struggling. They're struggling.
This is something that I really struggle with, is this pattern recognition, right? Like I quite often I can see the way something is going with people that I follow on social media, or, people in discussion forums, and you can see that pattern and you can see where the birth is headed.
Yeah.
And it's heartbreaking and frustrating. But it's hard to persuade, like not persuade, because you can't persuade someone. It's hard to inform somebody and for them to then make a different choice at that point. Yeah. Right, which is why the early prep is so important, I think.
Yeah, I agree. And also, let's not discount the women that are induced that have a great experience, because, their baby was ready. Their baby was ready to come out, and then it works. Or people that have to be induced because there is a medical issue. And for sure, then I would have taken the induction over a straight C-section. But for me, it was completely preventable, and I'm glad that I really stuck to my guns. But I will tell you, it wore me down. And honestly, I felt like I was about to have a nervous breakdown. And also, it's important to note that my pattern recognition worked out keywords that you could say to let them back off, like, I'm feeling really pressured now. And then they're like, oh, okay. But it shouldn't take that you have to say key words, like, I'm about to have a nervous breakdown because of you. That you're left alone for a little bit. And the amount of forms I had to sign, Erin, to basically say, I am willing to put everyone at risk, apparently, for my choices. But it's not presenting both sides of the argument, because I really feel like the induction would have put me at more risk with my allergy and my state of mind, and also my autism, on a labour ward.
Yeah, and I think a lot of people that go through inductions without all of those other factors like allergies and autism don't get informed the risks of induction. Don't inform the benefits of waiting. A lot of the
Yeah.
information we receive is really biased, and intentionally so, unfortunately.
Yes. My best advice is for everyone to read the package insert, and not just the patient leaflet, but the package administration insert, because that will tell you everything you need to know.
Yeah.
How can you be sure that it wasn't the drip that made your baby's heart rate go up tenfold? That wasn't the reason for the emergency of why you needed to get the baby out quickly, or it wasn't the epidural that did that, and you only needed the epidural because of the induction drip being so much more painful, and your brain not registering it in the same way as it does natural oxytocin. Women are just like, unless you do your own research, you're not going to know this. And what is shocking is that most of the people that are pushing for these inductions, telling you the benefits of them, haven't read these instructions themselves.
Yeah.
And that, to me, is what was shocking, that I had to go all the way to somebody's house to print out those inserts, which are available on the internet, to carry and put in my maternity book.
It's just
So, yeah.
Bonkers. It is bonkers.
It is.
And yeah, I don't know. I don't even know what to say.
Yeah.
It blows my mind. I'm not surprised, but it makes me really angry.
Yeah. And I can see why so many people decide to birth outside the system, because it's hard work. Like, and I definitely think for my second, I would consider more of a home birth, but the cleaning up process is putting me off. Like, dismantling the pool and all those things. It's
That's
just,
right. Your husband gets to do all that bit. It's not your problem.
Husband has ADHD, so probably not. I can't even get him to put his clothes in the laundry basket, so definitely probably not the best idea. But I think if I was like not able to use a birthing centre, I would definitely birth at home. But I think because it was my first and I had no idea of my level of pain tolerance or what I was going into, I think I made the right choice for me. I definitely made the right choice for me, and I can say that with hindsight. But yeah.
If you could give somebody like three key things that you think is really important for pregnancy and birth, navigating pregnancy and birth, either as a neurotypical person or an autistic person, entirely up to you. Yeah. What would those three things be?
1, pick a hospital you're actually comfortable with, that is giving you the care that is tailored to you, because that's what it should be. It shouldn't be generic care. 2, read the package inserts for everything that's suggested, even if it's paracetamol, read it, because you need to be informed. And 3, do not, regardless of your neurotype, be afraid to ask questions or question authority, because for far too often we all have white coat syndrome, and it's like, who are we with no education to question, somebody that has studied and worked in this job for so many years? And actually what I've learned is I have every right to question, because it's my care, but also at some points my stats are well, they're definitely more informed than the information that you're giving me, which is just based on what you were taught, not necessarily what is true. So those are my 3 points. I really hope that there is more kind of education for the NHS staff on kind of neurodiversity and how to better kind of care for our kind of neurodivergent population, because let me tell you, it's hard work advocating for yourself. I paid for a doula to effectively help me with my birth and my choices and my needs, and I interviewed 60 doulas. Can you believe it? 60 doulas, because no one was able to help me in the way that my brain needed. And I found somebody who actually has ADHD and also has an autistic daughter. That was your recommendations. Thank you very much, actually, because you've been so helpful. But she was amazing, but to the point where she was so amazing, and also the birth centre was so amazing, that I didn't need her for the birth, because she prepped me so well, and I knew that all of my choices would be so well respected. But I know it's not within everyone's financial means, but there are a lot of online and virtual doulas that are very accessible financially, and that would be my best advice and fourth tip, even though you only asked me for 3.
I love the bonus tip though. It's a really, really good one.
Yeah.
Thank you so much for sharing everything with us today. And if anyone wants to follow you online and hear more about, you know, being autistic and being a new mum and everything that goes with that, where can they find you?
I am the Autistic Chef, so the.autistic.chef on Instagram. Gave up with TikTok, so yeah.
Probably not a bad thing. I spend too much time on there. It's a bit of a time waster. My addictive ADHD brain just keeps on scrolling.
Yeah, it's hard.
Thank you so much, Vanessa. It's been a pleasure talking to you, and I can't wait for everyone to hear the episode. And keep me updated on how things are as motherhood.
I will.